Our next department is our Human Resources. I see they are here in chambers. Would you please approach, state your name for the record, and you may proceed with your testimony.
Good afternoon, Mr. Chairman, members of the City Council. My name is Pedro Rodriguez. I'm the Director of the Office of Human Resources with the City of Philadelphia. On the table with me are the Deputy Director of City O'Leary and Deputy Director Valerie Hosendorf. I also have members of my staff here. And I want to give a shout out to our Medical Director, Dr. George Hayes, who's here in the audience. He's perhaps the most beloved public civil service employee that we have in the City of Philadelphia. I have submitted a written testimony. I'm just going to go over some of the highlights of the Department of the Office of Human Resources. As in regards to our accomplishments, on the issue of diversity and recruitment efforts, OHR has increased all of our efforts to diversify the applicant pool for civil service employment throughout the city. We have attended a number of and participated in a number of job fairs organized by the community organizations, universities, members of City Council, and other public elected officials. We also have increased our social media presence to attract and get our message about openings on civil service to all corners around the city. One thing of note is in December of 2016, OHR implemented an online job notification system which allows individuals who wish to apply for a particular civil service job not currently open to be notified automatically when that job opens. As of this date, we have 36,000 individuals who have requests to be notified when job openings occur for 950 different job titles. In fiscal years 17 and 18, 4,495 candidates were hired from civil service eligible list. The demographic composition of these successful candidates was 22% Anglo, 37% African American, 5% Latino, 3% Asian, 2% multiracial, 1% Native American. 30% of the candidates did not disclose their race. Another initiative that we have initiated is real job time candidate data that allows the HR managers throughout the city to see the list of candidates on eligible list. That facilitates their the hiring process for all of those departments. On benefits administration, we have done a tremendous work on getting the most money for our expenditures on health benefits. One of the things that we are proudest the most is our wellness program, which is a leading program in the region. And the participation in that particular program beats national percentages by a large margin. Last year, we have 46% of participants in the program finishing the wellness programs, and it is one thing that we continue to expand, look at, because the results and the return on our investment is paying dividends in terms of the well-being of the city workforce. OHR continues to partner with different departments and with the Office of the Chief Administrative Officer to continue to provide improvement to our hiring process and administration and compliance of human resources for the city. The proposed funding for fiscal year 19 is a total of $6,343,169, which constitutes an increase of $476,140 over fiscal year 18. This increase is primarily due to one position to support the new process designed for position exemption requests as a result of the implementation of the One Philly program. Also, the increase reflects a pay increase for our DC 33 members, and also includes an initiative, a diabetes prevention program, as well as an audit of our city pharmacy benefits. With that, I'm open to questions that you might have.
Thank you. Chair recognizes Councilman Greenlee.
Thank you, Mr. Chairman. Good afternoon. I know you answered a lot of questions this morning, especially relating to diversity and on issues like that. Just on that online job notification, you said 36,000 for 950 job classes. That's a whole lot of folks.
It's a lot of people.
Now, those 950 job classes, how many actually, do you know, or roughly, how many are actually hire? Or are a lot of them just, I guess what I'm getting at is, if people apply for or be put on the list, do a lot of those classes actually come up? Are they actually hired, or are people hired for that, I guess?
Councilman Greenlee, thanks for that question. One of the reasons why we instituted this particular job notification program is if you were a job applicant, you had to constantly keep checking the website to see when a particular job that you were interested in applying will open to take application for the examination. This way, people sign up for it, and then they get automatically notified. So we break it down week by week to see which job titles are the most interested for that week.
Okay.
We have anecdotes of people who say, "Thank you for that because I applied, took the test, and was hired from that process."
So they don't have to keep checking, you kind of check for them.
Exactly.
That works. That seems to make sense. And one other thing, on the, you list the Democratic composition of the candidates, and maybe this is tough to tell because you say 30% did not disclose race. Is that any significant changes, those figures, 22%, 37%, from previous years, do you know, or is that roughly around the same?
In terms of, I don't recall if we were keeping track prior to this.
Okay.
We're beginning to keep track more rigorously about that. We have data over the years about the composition of civil service workforce and its breakdown.
Okay. Okay, I appreciate that. And let me just say, I always appreciate you have been very responsive when I have called you. I like to think those of us who have been around government for a while, I've been around a few days, I think you've been around close to, a few days. So I think you certainly get how this works and get what's important. You worked here in council for a little bit, so you know the kind of issues we're involved in. So I really appreciate it. I think the department has done very well under your leadership, so thank you.
Well, thank you very much, Councilman.
Yeah. Thank you, Mr. Chairman.
Thank you, Councilman. I have a few questions. So, in addition to some of the questioning that, answers that you had, throughout, the morning and the day so far, people take the civil service test, they go online, you get hired. Is there a health screening backup log for hiring people where they're waiting for physicals or TB testing, by the city so they can be hired, that you're aware of?
Councilman, I would like to bring our medical director to specifically answer the question. We have a list of specific job titles that require the candidate to pass.
I figure I think you got the top doc here. I might as well ask him a question.
Absolutely. Dr. Hayes? And may I introduce Deputy Director Marsha Green Jones, who runs our benefits unit at Jonia.
Okay. Hey, just state your name for the record and your title, and then.
George Hayes, I'm Medical Director of Employee Medical Services. And I think the question that you asked was whether there is a delay in doing the physicals for certain job titles?
Yes.
Okay. At this point, we have really been doing very well in getting these physicals done, as well as the various testing like PPDs, and there's not a backlog. Currently, we're in the process of talking with Jefferson's Health Mart to do the next class of police officers. I met with them last week so we can have a pilot program until we can get our staffing up to the level that it was. We had one physician assistant leave us over the last 60 days. But things are going well at this point.
Okay, so you'll see if Jefferson can move things a little quicker while you staff up. So you have, is the 2 physicians and 1 physician assistant, PA, are they in the 5-year plan for staffing levels?
Yes, they are.
Okay, and what is the timeline do you?
I would imagine over the next 30 to 45 days, we should have those positions filled.
Okay, so there's active candidates that you're looking at for the position?
Yes.
Oh, that's great. And what was our backlog? Like, I don't want to get too nitty-gritty in the details, but in some cases, could it be you're waiting 2 months, for screenings or testing, or
No,
weeks?
it's not that. What happens is that we get a set number of police officers every day because police test continuously. So we get 10 police officers 3 days a week. We get a set number of firefighters. However, because of the listing, the way it's developed by the fire department, when they have a class that they anticipate, then that volume increases to maybe 10, 15 applicants a day. The current class, they have 130 people to be evaluated. So we're going to do that because economically it works better for us to do that than for HealthMark to do that. And what HealthMark will do is take over those 10 slots for police. And it gives us a chance to have them as a backup for this very thing in the event there is a delay. The PPDs and the various testing done in the office, we have staffing adequate to do that. We have medical assistants that are in place, as well as police internal affairs that does their urine and hair testing.
So is it primarily in first responders or police and fire and crossing guards, as opposed to other vacancies that are filled, or is it anybody who takes a civil service test?
Well, all job titles, those physically demanding job titles, such as corrections, police, fire,
Crossing
youth
guards.
detention centers, youth detention counselors, crossing guards, laborers, semi-skilled laborers, electricians, all of those jobs are jobs that require physicals, and each of them have a different series of testing that's done based on that job title.
Well, and we will be staffed appropriately. If not, I mean, we could just ask for more people, right, to help move things along. I don't mind asking, our finance director or budget director for another physician.
This position, the physician has to do with retirement. We had to fill one of a physician retired, and then just to reemphasize what Dr. Hayes would say, we want to utilize the pilot project when we have the perfect storm, so to speak.
But you have the high demand, right?
Because you have different classes at the same time for uniform personnel.
No, I understand that completely, and it's actually smart. This way you can keep things moving and, not keep these key, public safety positions or frontline, vacancies empty, so we can keep things moving. Well, thank you so much for your time.
Thank you.
A couple of things you had mentioned in your testimony. You're talking about savings and reduction to emergency room visits, and also surpassing the national average in the wellness participation, by 11.5. Can you put a dollar value to a lot of that? Because I've been a big advocate, and along with other members with childhood obesity programs, in preventative diseases, and nationally it's over 300, it's like a lot of zeros, as you can imagine. Do you have a dollar value in savings, and what is, when you talk about the rate of return, like what, for every ounce or dollar of prevention, what are we getting back in savings?
Thank
So
you
there
for
are
that.
like three different questions.
Thank you for that question. And I wish but anyway, I'm going to ask Deputy Director Marsha Green Jones to respond specifically to your questions.
Okay.
Good afternoon, Marsha Green Jones, Deputy Human Resources Director for Health and Welfare. Generally speaking, the wellness program in itself is more of a cost avoidance in terms of reducing the costs that we could possibly incur as a consequence of employees actually developing chronic diseases. So as a consequence of the program, we're able to reduce the
utilization?
Yes, exactly. Reduce the employees becoming diabetic. That's why we focus on pre-diabetes, identifying employees who are at high risk for hypertension, have cholesterol issues as well. So by us involving and developing the wellness program, we're able to avoid cost. Can you put a number on that cost avoidance? It's kind of difficult to say, but certainly it's over $700,000, but it's not a number that you can point to. It's basically cost avoidance. With regard to the emergency room, one of the things that we looked at was a high utilization of the emergency room for employees going there for non-emergent reasons. And one of the things we thought about is perhaps people were going to the emergency room because when you go there, you don't have to pay immediately. They will bill you, as opposed to when they were going to an urgent care center, we were actually billing them right on the spot for $75. In past experience, I've known programs to actually reduce that cost to a specialist copay of generally $30 to $40 is the general norm for urgent care centers. So our thought process was, while we reduce the cost of urgent care centers to $40, we increase the emergency room copay to $300, and we do not waive that copay if you're hospitalized. We actually reduce it by $100.
So it's a disincentive for somebody
Exactly.
not to use the emergency room as their primary doctor.
Yes, and so we were able to reduce our, we were able to increase our urgent care visitation by 50%. We were able to increase our retail clinic visits by about 17%, and we were also able to reduce our emergency room non-emergent reasons by about 17%. And typically people go to the emergency room for non-emergent reasons, for headaches, generally speaking, asthma, those sorts of things. So people are thinking twice, I think, in terms of before they go to the emergency room for something that perhaps could be treated in the urgent care center.
So who takes a look at our benefits plan? Do you review the utilization and the follow-up to say, all right, so somebody goes in, it's either asthma, right? And so they go to the emergency room and it winds up being asthma, or maybe it's not asthma. I don't know, but do we work with our healthcare provider, all right, to really get down to the algorithms or the trends on the utilization, because there is a cost associated with utilization, and I totally believe, although I don't look like it, wellness programs that will help in the many different ways, right? Whether it's sugar, diabetes, your heart disease, and any other contributing factors that are preventative. I believe in that 1,000%, and it also lowers the cost of our premiums because our utilization's down.
Yes, that's an excellent question. We look at a number of things to try to get a good sense of our trend. So we actually employ a consultant, Aon Hewitt, who actually helps us in looking at all of our plans, whether it's the medical plan, the prescription plan. We look at adherence. Are people actually who've been diagnosed, let's take diabetes for example, or hypertension. Are people who've been diagnosed with those chronic diseases, are they going to the doctor? Are they adherent to their medication? One of the things we look at, and this is how we actually focus our attention from a medical perspective, we've identified that 19.9% of our employees who actually have hypertension are not adherent. The national average is 30%. And when speaking with the health department, the chronic disease head who I work with quite closely, one of the things she said to me, Marsha, that's phenomenal. You are better than the actual norm out in the business place. So one of the things we constantly look at is how our adherence is. We actually approach this from a health perspective. Employees get letters, they get notifications in terms of if they've not filled their prescription. We also have a maintenance fill program so that if an employee actually takes a maintenance medication, say for diabetes or hypertension or cholesterol, one of the things we try to do is incentivize them for actually getting their medication a 3-month supply versus a 1-month supply.
I was just going to ask
Yes.
that question, because that reduce on your script costs.
Yes.
Question about narcotics and
Oh, yes.
opioids. So what is the policy, is there a policy for reviewing not confidential, information, of course, but, the amount of people who utilize or take in narcotics and or opioids on I think some of the healthcare providers are internally going to a 5-day and then needs admin approval for further approvals. Is the city taking that same approach or considering taking a look at that?
Yes, as a matter of fact, actually, for the first 6 months of this year, we actually rolled out the labeling prescribed guidelines for our employees. And we've actually sent communication out to all those affected employees indicating that they need to follow the proper procedures in terms of the label distribution of the medication. Effective July 1st, we will actually be distributing the narcotics using the CDC guidelines with the morphine minimum requirements. So employees will only get 7 days worth of prescription as opposed to the label dedicated numbers. Curiously enough, we have actually very few employees in the CAP program who actually use narcotics. Typically, the way this program is set up is employees who are at end-stage renal disease, who have cancer, who have any comorbidities that actually require that they have this medication it will not affect them at all, because our goal is to continue to make them comfortable and that we do not interfere with what they're doing currently in terms of their dispensation of their actual medications. So we're not trying to interfere with those employees. Just from a numbers perspective, one of the things that we did see, which was interesting, that we've discussed with Active Health, our wellness provider, and also with IBC as well as CVS Health, is that we only had this year 5 employees who actually had to go to the emergency room for an overdose or perhaps an overdose. So those numbers speak clearly in terms of the minimum level in terms of employees actually engaged in using narcotics.
Well, they're absolutely good. Great metrics and good numbers to report. We've had hearings, and it's not necessarily for this hearing here today, but we have had hearings on opioid addictions, and how are they being treated, and you get into this public debate, and nobody's a doctor who's debating all this, right? But one of the numbers that did come out was that there seems to be, through surveys, approximately 70,000 people Philadelphians addicted to heroin, but double that and then some who are on some sort of opioid or a prescribed drug that's given to somebody for hopefully a temporary illness, and that's why I asked about the prescription 5-day. You say we're going to a 7-day, and then it would need some sort of override authorization or something like that under care. So that's good news, and I think we should be talking about that in the same vein as we are, talking about other, substance abuse. Although, this may not be abused, but there seems to be a large population of Philadelphians that are doing it, and that we're aware of it as a city, and we're keeping on it. Now, the 90-day mail-in script, that reduces our costs.
Yes.
Correct? And what percent of our utilization are using, taking advantage of the mail-ins? Maybe like is it up to 10% yet?
Oh, it's more than 10%.
Is it 10%?
Oh, yes, it's about 36% or more. Because remember, also our employees can go to a local CVS and pick up a maintenance bill there. So it's not, you can mail order it, or you can actually go to a local CVS
So they give you
pharmacy.
30 days?
They will
or
give you 90
days.
days. Yes.
A 90-day supply?
Yes.
As opposed?
Yes.
Good. All right, and because I know in previous healthcares that, you go in there, you move to a mail order, all right, the 90-day, all right, you go up, you're still thinking, because, not everybody reads their mail, including myself, right? So you don't see the change in the plan that they're required to mail out and notify its customer that, all right, when you go to a pharmacy, all right, you're gonna get denied, all right, or informed that, hey, you need to go to a 90-day. So that seems to be working.
It's working extremely well. So from a communications perspective, we have several different vehicles that we use to communicate these types of changes. So one of the vehicles we use is CVS actually has an app that employees can sign up for. We have the enrollment guide that we distribute to every single eligible employee, whether they enroll in our program or not. We also send communications to home to our employees. We have lunch and learns. This year alone, we actually had over 1,200 employees participate in lunch and learn sessions. So we have various ways and we have a newsletter. So we have over 5,000 employees actually enrolled and receiving a newsletter, which is distributed bi-monthly. So one of the things that we do is we continue to communicate with employees. We continue to communicate with the HR community on a monthly basis about changes and opportunities for employees to take advantage of the actual benefit programs we offer.
Great. Love what I'm hearing. Keep up the good work. I know our city council, administrators that we have here in our wellness, Linda and Mary Ellen, they do a fantastic job with notifying, all of council staff on the wellness programs, the enrollment of the programs, the opportunities that they have. So, I mean, I believe in it, and, I hope it continues to trend in the direction that you're saying. So if there's anyone else here who has any other questions, being none, I want to thank you all for coming in and for your testimony. We will now, give me 1 second here so I can properly close, so I don't get yelled at. All right, and since there's no other questions, this committee will stand in recess until Tuesday, April 17th, 2018 at 10 a.m., in which time we will reconvene right here in this room, City Hall, room 400. And I want to thank you all and have a great, safe day. Thanks.
Thank you.